The next topic is cerebellum. We want to discuss some details of cerebellum now, and what you find is a question. This question is asking us the function of spinocerebellar tract. When the question came, we thought that it is a physiology question and there could be multiple answers, but lately it has been identified that it is a direct question from Gray's Anatomy. Now, if it is a direct question from Gray's Anatomy, what is the answer? Because physiology books will give you multiple answers, one single answer will be given by Gray's Anatomy. So, triple answer according to physiology books and a single answer according to Gray's. Can this be the answer? Oh, why? Because this is the job of basal ganglia. Planning and programming of voluntary motor activity is basal ganglia. So, what is the answer then? Because there are three possible answers according to physiology books. The Gray's Anatomy says this is the answer: coordination of voluntary motor activity for. It is the coordination of voluntary motor activity for, say, walking in a straight line. Walking in a straight line. Actually, spinocerebellar tract carry the unconscious proprioception towards the brain. What is unconscious? Unconscious means it will not reach the conscious level cerebrum. It is stopping at the cerebellum level, unconscious level. So you're telling the answer is choice number B, coordination of voluntary motor activity. Yes. How do you do that? I want to walk in a straight line. So my lower limb should send some information, which is unconscious proprioception. So unconscious proprioception of the lower limb is carried by the spinocerebellar tract. Yes, to the cerebellum, not the cerebrum. And because it is going to cerebellum, it is unconscious level. If it goes to cerebrum, then you say conscious proprioception. But this is unconscious. What will happen if it is damaged? What? The spinocerebellar tract? Yes. Then there will be ataxia. What ataxia? It is cerebellar ataxia. How do you know it is cerebellar ataxia? Injury of spinocerebellar tract can result in cerebellar ataxia in coordination. How do you know it is in coordination? Because the patient is not walking in a straight line. Patient is not walking in a straight line. No, actually. Okay, let us discuss some more details, but the answer remains choice number B. Keep the answer as choice number B and look at this lady. It's a valid answer. Coordination of voluntary motor activity is quite unique and you need cerebellum there. Though you need basal ganglia for planning and the pyramidal system for execution, but cerebellum for coordination. So cerebellum for coordination of the voluntary motor activity? Yes. And what if it is not coordinating? Then there is a problem. See, cerebellar ataxia is a problem where the patient cannot walk in a straight line, keep falling to the same side of the lesion, and some other features. Heel shin test will become positive. What is that? Heel shin test will become positive. Yeah, fine, but what is that? See, this man has cerebellar ataxia due to injury of spinocerebellar tract. And see how is it walking? Uncoordinated, clumsy movement. There is ataxia, ataxic gait. It is the anterior lobe of the cerebrum which is involved. Now, if you say anterior lobe of the cerebrum involved and something wrong with the ataxic gait and some uncoordinated clumsy movement. What about the other components of the cerebellum? There's a posterior lobe also. What about that? See, first you talk about this same patient, your heel shin test was positive. Yeah, what is heel shin test? Actually, you have to tell the patient, move your heel straight on the shin. But this patient will not be able to move the heel straight on the shin. The heel goes here, 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 here. Not going straight. Why it is not going straight? Because you don't know the position sense of the lower limb. Spinocerebellar tract is compromised. As spinocerebellar tract is compromised, I don't know the position sense of my lower limb. So my lower limb keep going in coordinated fashion. Zigzag. It is not straight. Heel shin test is positive. And patient having cerebellar lesion, there are many things. Not only there is ataxia, but there is also nystagmus. Nystagmus. And when you say there is nystagmus, fine. Is there a resting tremor or? That is wrong. That is the answer. It is not resting tremor. Then what it is? See, in cerebellar lesion, it is not resting tremor. It is intention tremor. If you say it is intention tremor, can you tell me what is intention tremor then? Intention tremor means when I have intention of a movement, tremor will come. Otherwise, there is no resting tremor. Means there is no resting tremor. No. And if the examiner is telling me, touch my finger, then there will be a tremor. Yes. Intention tremor. Normally, there is no tremor. So, you're telling that there is an intention of movement. Yes. And that time, there will be tremors. Yes. Okay, so this is the answer. Where do you see resting tremor? Resting tremors can be Parkinson's disease. And when you are talking about Parkinson's disease, it was some basal ganglia disorder, extrapyramidal symptomology, extrapyramidal symptomology. But resting tremor here, it is not fitting. So will there be a pass pointing? Yeah, pass pointing. You're asking the patient, touch your tip of finger with my tip of finger. But the finger goes like this and then touches. And then touch your tip of nose and now touching like that. So pass pointing is there, of course, but resting tremor is not there. See, this is how you do it. You have to ask the patient, touch the pen. Touch your nose. So when the patient is touching the nose or the pen, there will be a pass pointing. The finger will go beyond the pen and then touch the pen like that. Pass pointing. Anyway, cerebellum, let us look at some more details, the parts and their functions. Like we said, anterior lobe is there. There is a posterior lobe also. See, when you are talking about cerebellum, it is in the posterior cranial fossa. The cerebellum is in the posterior cranial fossa, and when you are looking at cerebellum, it will have some leaf-like appearance. Leaf-like appearance means foliated. It is foliated. Arbor vitae is the other name. Arbor vitae. So you are telling that it is leaf-like like this. Yeah, arbor vitae. And what else you want to know? Actually, do you remember that this is the fourth ventricle? So it is at the roof of the fourth ventricle. Yeah, okay, roof of fourth ventricle. What else? It is attaching to brainstem with some peduncles. There will be a superior cerebellar peduncle, middle cerebellar peduncle, and inferior cerebellar peduncle. So cerebellum is attaching to brainstem with some peduncle, superior with the midbrain and middle with the pons and inferior with the medulla oblongata. Yes, peduncles, cerebellar peduncles. Then there will be one anterior lobe, there is one posterior lobe, and there is one more. What is that? Flocculonodular lobe. So there is one anterior lobe, there is one posterior lobe, and flocculonodular lobe. Flocculonodular lobe. The flocculonodular lobe is the oldest. If flocculonodular is the oldest, then which is the latest? Latest is posterior. If you say posterior is latest, neocerebellum? Yes, neocerebellum. And then who is the archicerebellum? Archi is old. You know, archaeology. Archaeology, oldest. So oldest is flocculonodular. I want to see the flocculonodular lobe now. Okay, we'll see that, but that is archicerebellum. See, anterior lobe is somewhere in the middle in evolution. In evolution, this is the oldest. Archicerebellum is flocculonodular lobe, and in between the temporal line, this is anterior, but the posterior is the latest, neocerebellum. With all that information, see, this is the flocculonodular lobe, the oldest, the archicerebellum, that blue color. So that blue color is flocculonodular lobe, and that is the oldest. Then who is the newest? Newest is this, posterior lobe. And who is somewhere in the middle? This is the anterior lobe. In temporal line, this is somewhere in the mid region of timeline. Okay, fine. Now we are looking at the coronal section of the brain from the front view. And when you look at the coronal section of brain from the front view, you can see this is the cerebellar hemisphere on the right and left side. If these are the cerebellar hemisphere on the right and left side, I think they are attaching to brainstem. Yes, this is brainstem having three components. Then you can tell this is midbrain and the pons and medulla oblongata. So attaching to brainstem, it will be three peduncles. What are the three peduncles? Actually, This is the middle cerebellar peduncle attaching to pons. It will carry pontocerebellar tract. Now, if you say middle cerebellar peduncle is connecting pons and carrying the pontocerebellar tract, then what is the superior cerebellar tract carrying? And what is the inferior cerebellar tract carrying towards the medulla oblongata? This is all what we have to discuss. And then you can tell that this is the highest brain, the largest brain, the cerebrum. If that is the highest brain or the largest brain, the cerebrum, fine. We need to have some orientation because later we'll draw a diagram. This is the thalamus sandwiching a third ventricle in the midline. Now, if you say this is the thalamus sandwiching the third ventricle in the midline, fine. This is just for the orientation purpose because later we'll draw the diagram. Now, here I have asked one patient to move in a straight line. So the patient is moving the right lower limb. Right lower limb. Now, as the right lower limb is moving, there's a change of position, and that change of position will be carried by right-sided spinocerebellar tract towards the cerebellum. So as the patient is trying to walk in a straight line moving the right lower limb, the right lower limb is changing position. That proprioception will be carried by spinocerebellar tract to the cerebellum. Let us discuss that pathway now in this cornal section which we have just discussed. So you are telling that right lower limb was moving? Yes. Which tract was activated? This. What is this? This is spinocerebellar tract. So this is right-sided spinocerebellar tract which is activated. Where is it carrying the position sense towards? The position sense towards the same-sided cerebellum. And what is this peduncle used here? Spinocerebellar tract is using the inferior cerebellar peduncle. So you are telling spinocerebellar tract will use inferior cerebellar peduncle to reach the same-sided cerebellum. Now, the cerebellum will communicate with the opposite thalamus. And as the cerebellum is communicating with the opposite thalamus, it will be using which peduncle? Actually, this is called as dentatothalamic tract, coming from the dentate nucleus to the contralateral thalamus. So it is coming from dentate nucleus of the cerebellum towards the contralateral thalamus, the dentatothalamic tract. Dentatothalamic tract is using which peduncle? Of course, the dentatothalamic tract will use the superior cerebellar peduncle. And what is the thalamus doing? Thalamus is communicating with the left cerebrum. Which limb was moving? Right lower limb. But the information has been received by left cerebrum. Why the left cerebrum? Because left cerebrum should have the processed information of the movement of the right lower limb. As the right lower limb moved, the cerebellum was processing the information, and processed information comes to the left cerebrum. But why the left cerebrum should receive the processed information of the movement of the lower limb right side? Because it is the one which is having the corticospinal tract to move the lower limb. And before it moves the lower limb on the right side, because there are crossing of fiber in the lower medulla, see, corticospinal tract comes from the cerebral cortex to the spinal cord, is crossing in the lower medulla to control the opposite side lower limb. So if you want to move the right lower limb, you have to work from the left cerebrum, and that's why the left cerebrum required the information of the position of the right lower limb, because then only it can coordinate the movement. So corticospinal tract, part of the pyramidal system which moves the contralateral lower limb, which is right lower limb. You need coordination. Yes, coordination, and all this is important. This is what we are going to draw in a diagram now. But before you do all that, you see, cerebellar pathways are quite varied, and we will focus upon some and defocus from the others. So as you're doing it, we were telling this man to walk in a straight line. This is the right lower limb moving and right spinocerebellar tract is activated. You will understand that it is running ipsilaterally going to the same side of cerebellum. So you are talking about the dorsal, yeah, it is posterior or dorsal, right-sided. So right-sided dorsal spinocerebellar tract, or you can say right-sided posterior spinocerebellar tract, is running ipsilateral going to the same side of cerebellum. Is that so? Yes. And these are actually mossy fibers. They are mossy fibers. Remember that most of the fibers which enter the cerebellum are called mossy fibers. So there will be some more mossy fibers. Now, very few fibers are crossing the midline and start running as the ventral spinocerebellar tract. Anterior or ventral is same. You mean to say right lower limb was moving, but the information crosses the midline? Yeah, the movement of right lower limb, information crosses the midline and start running as the ventral spinocerebellar tract to reach the contralateral cerebellum. But then this contralateral cerebellum is telling, where are you coming? I am not your cerebellum. Go back to your own cerebellum, and it will go to the same sided cerebellum. You mean to say left cerebellum is telling that you should go to the right cerebellum? Yes. So there is a crossing and recrossing of fiber. Yes, actually crossing of fiber is in the spinal cord and recrossing of fiber is within the cerebellum. Within the cerebellum. So within the cerebellum there will be some crossing of fibers. Yes. Understand, here it is using the superior cerebellar peduncle to reach the opposite side cerebellum, and here it was using inferior cerebellar peduncle to reach the same sided cerebellum. You mean to say dorsal spinocerebellar tract uses the inferior cerebellar peduncle to reach the same sided cerebellum, and ventral spinocerebellar tract is using superior cerebellar peduncle to reach the opposite side of cerebellum. Yes, but later the fibers will cross the midline, and within the, it is not using any peduncle now, no peduncle here, because it is within the cerebellum the fibers are crossing. That is why if I have a tumor on the right sided cerebellum, where the clinical features will come? Cerebellar lesions are ipsilateral, so the problems will also come on the same side, ipsilateral problems. See, cerebellar connections are ipsilateral most of the time, and cerebellar lesions will give clinical features on the same side, ipsilateral clinical features. Maybe the fibers of the right lower limb change of position was going to the left side, but then again it came back to right side, ipsilaterally. Okay, with that information, we got one more question. This question is asking us, the marked cell is inhibiting which of the following structure? What is this? This is the 3 layers of the cerebellar cortex. If you say these are the 3 layers of the cerebellar cortex, what are the 3 layers? There is the outer molecular layer, there is a Purkinje layer, and then there is an inner granular layer. Okay, there is an outer molecular layer, there is a Purkinje. Are you talking about Purkinje cell here, the arrow mark? Yes, that is the point. Arrow mark is Purkinje cell, and then there will be some granular layer. So you are talking about the Purkinje cell here. Yes. How do you know it is Purkinje cell? You can identify. If you keep practicing MCQs, then you can identify. You have to practice the slides. Okay. So we are now going into details of the cerebellar cortex. Look at the cerebellum from the posterior view. To discuss the cerebellar cortex and the 3 layers in the cerebellar cortex. See, when you look at the cerebellum from the posterior view, you will find that it will have a vermis in the midline. Now, if that is a vermis in the midline, fine. What else is there? There is one anterior lobe. This color, anterior lobe. If you are telling that color is the anterior lobe, fine. Then there will be a posterior lobe also. Yes, there is a posterior lobe also. Posterior lobe. So you are telling that there is one anterior lobe and there is a posterior lobe, and then there is a midline vermis connecting the 2 cerebellar hemispheres. Yes, you can say that there is a vermis connecting the 2 cerebellar hemispheres. There is anterior lobe. Which one is more latest? Actually, posterior. We have learned that posterior lobe is neocerebellum. It is more latest in evolution, and anterior lobe is old in evolution. Okay, which is the oldest then? If you say oldest, we will find out. But remember, there is a primary fissure which is separating anterior from the posterior. So you are telling that there is some primary fissure here? Yes. There is some primary fissure here. Yes, that is a primary fissure. And this primary fissure is separating anterior and posterior lobe. Yes, that is a primary fissure. Where is the flocculonodular lobe then? That we will discuss. But here, as you are talking about the posterior view of the cerebellum, take a cornal section. Why? To see the deep cerebellar nuclei. So you are taking a cornell section to see what? The deep cerebellar nuclei. Deep cerebellar nuclei, who are they? They are actually D, E, F, G. What is this D, E, F, G, deep cerebellar nuclei? We'll discuss that. But can you see there is this arbor vitae? What is arbor vitae? Actually, there is some white matter coming and then going into the folia of the cerebellar cortex. This leaf-like thing is folia. So that leaf-like thing is folia, and there is some white matter, arbor vitae, coming into the folia like branches of the tree. Yeah, like that. Okay. Tell me about the deep cerebellar nuclei now, and tell me about the 3 layers of cerebellar cortex. As you are talking about the 3 layers of cerebellar cortex, you have to discuss the 4 nuclei of the cerebellum also. See, deep cerebellar nuclei, as you discuss, DEFG. D is for dentate nucleus. It is the most lateral. If you say D is for the dentate nucleus, the most lateral, then what is E for? E is emboliform. And F is for fastigiae. This is the most medial. So that is the most medial. Not only it is the most medial, it is also the oldest in evolution. And what is G for? G is for globose. These are called as interposed nuclei. Interposed nuclei. So you are telling that there are 4 deep cerebellar nuclei. Yes, they are actually DEFG. And what is D for? D is dentate, the most lateral. Which is the most medial? The oldest. Who is the oldest? That is a fastigiae. And what about the emboliform? E for emboliform and G for globose. They are interposed nuclei. Once you have that kind of information, also remember dentate is the latest in evolution. The lateral most and latest, LL. Yes, LL. Lateral most is the latest in evolution. In evolution. Okay. Then this is the diagram we want to discuss. Yes, actually. See, this is the vermis in the midline. If you say that is the vermis in the midline, fine. That is the vermis in the midline, fine. And you can also see the fastigiae nucleus, which is the most medial and the oldest. Most medial and the oldest. So this is the vermis in the midline, and this is the fastigiae, which is the most medial and oldest. Yes, most medial and the oldest. In evolution, yes. Now, which is the most lateral? Most lateral is the dentate nucleus. Lateral and latest in evolution. So lateral most and latest in evolution. Yes. What about the interposed? Interposed. This is interposed nuclei, emboliform and globose together. So telling emboliform and globose together are interposed. Yes, they are the interposed nuclei. These are the deep cerebellar nuclei. Also, you can see the green color is the midline. This blue color is paravermal region, and this same color as my shirt is the lateral most. So this is the lateral most. Yes, actually we have to understand that vermis is the middle most, and there is a paravermal region, and then there is a lateral most region. The vermis region is oldest in evolution and related with the fastigiae nucleus. The lateral region is latest in evolution, related with the dentate nucleus, and this blue color is paravermal region, is related with the interposed nuclei. Whose interposed nuclei? That is globose and the emboliform. Like that. So just have some idea regarding that. And you have to understand, we were fish some time back in evolution. It gave us the fastigiae nuclei. So we got the fastigiae nuclei from fish in evolution. Yes. Then we were developing into reptiles, amphibians, and then we became mammals. So first we were fish in evolution, yes. Then we became reptile, amphibians, yes. Now we are mammals, yes. So what about mammals? Mammals got the latest or lateral most nucleus. Who is that? Dentate. So mammals have got lateral most latest, the dentate nucleus, yes, in evolution. And what about the aves, the birds? Birds, actually evolution came like this and divided. So fish amphibian, reptiles, and after that, mammals and birds. Mammals and birds. So we are mammals. And birds go there. Anyway, we are moving further. I have told you, Vermish is in the midline. It is the oldest. Paravermal region is intermediate, and lateral is the latest in evolution. Lateral is related with the dentate nucleus. You can see the arrow mark here. And the midline is related with the fastige. You can see the midline here. And then if you're telling interpose, then they are intermediary in evolution. So you're telling that oldest is the Vermish, and it is the fastige nucleus. It is, we got it from fish and evolution. Yes, maybe this we got from the amphibian reptiles, and this is the mammalian nucleus, which is dentate nucleus. Now with that information, you see this is the fissure we were talking about. And this is the flocculonodular lobe we were talking about. So this is flocculonodular lobe, the oldest cerebellum. Yes. This is the flocculonodular lobe, and that is the oldest cerebellum. And in evolution, it is the oldest. So these are some of the details which we need to know. And let us look at some other details now. As you're going further, you will find that we are going to talk about the archicerebellum now, which is oldest, which is flocculonodular lobe, and the nucleus fastigi. It is vestibulocerebellar pathway. You got it from fish? Yes, fish. What is fish doing? Balance, axial balance. It is for axial balance. You know, we have got the vestibular apparatus for balance, gravity. So you're telling that archicerebellum, the oldest cerebellum, is flocculonodular lobe, and it is related fastigi nuclei from fish and evolution. Is vestibulocerebellar tract? Yes. And remember, it uses inferior cerebellar peduncle to reach the cerebellum. So it is also using inferior cerebellar peduncle along with that dorsal spinocerebellar tract. Yes, there was some dorsal spinocerebellar tract which we will discuss again, but it is for maintenance of equilibrium. And what if it is lesion? If it is lesion, then there will be problems of equilibrium. Can you show some patient regarding that? Yeah, see here. There will be a patient here. I'll show you this patient. So you're telling that this patient has something wrong with flocculonodular lobe? Yes. There is a truncal ataxia, and so you're telling that something wrong with flocculonodular lobe, and there's some truncal ataxia. There's a wide base gait. Why wide base gait? Because they have a feeling of falling down. So wide base gait. So this is about the oldest fish. Tells us about the axial balance. Yeah, that is the point. Then what about the second one? If you are talking about the second one, it will be here. What is that? Actually, it is paleocerebellum, which is somewhere in the midline, in the timeline. Not oldest, not newest, somewhere in the middle. And it is anterior lobe. If you remember, we have discussed one patient with anterior lobe. The heel shim test was positive, and patient could not walk in a straight line, if you remember. So it is nucleus interpositus actually, and which is globose and the emboliform, and the tract is spinocerebellar. If you remember, we have discussed spinocerebellar tract is important for coordination also, walking in a straight line. And then if it is damaged, then you cannot walk in a straight line. That will be a problem. Let us look at the patient. Paleocerebellum is somewhere in the mid of the evolution, and it is anterior lobe plus those nucleus interpositus and spinocerebellar tract. I told you, where is the dorsal spinocerebellar tract moving? Maybe this or maybe this. Both of them use inferior cerebellar peduncle. So dorsal spinocerebellar tract or vestibulocerebellar tract, they use inferior cerebellar peduncle. Now, as you are talking about the lesions, you will find the patient was something like this. This was your patient, if you remember. Could not walk in a straight line. There was a problem with coordination, and heel shim test also became positive. It is a problem of anterior lobe. There's a gait ataxia. What about the third, the most latest cerebellum? If you say third or the most latest cerebellum, then it is here. What is that? That is the neocerebellum, the most latest, and it is the posterior lobe, and then it is the dentate nucleus, and it is the cortico-pontocerebellar CPC pathway. What is CPC pathway? See, the most latest is neocerebellum, and it is involving the posterior lobe, and it is the nucleus, dentate nucleus, the most latest and lateral most, and it is the CPC pathway. What is CPC pathway? Cortico-pontocerebellar. From the cortex you have the pons, and from the pons it is to the cerebellum, cortico-pontocerebellar, CPC pathway. And what is it for? Smooth performance of voluntary movements. Smooth performance of voluntary movements like what? What if it is lesion? If it is lesion, then you will find the patient is in front of you now. See here. This is the patient. There will be intention tremors. See, this is the latest cerebellum, posterior lobe, and there will be intention tremors. Remember? So that intention tremor is a feature of cerebellar lesion, and it is posterior lobe, the most latest, or the, you can say neocerebellum basically. Okay, fine. What is the second thing? Actually, we want to see the cells in the cerebellar cortex. There are 3 layers, and we have told that there is a middle Purkinje. Now, if the middle is Purkinje, then what is in the outer layer? Outer layer we have SV cell. What is SV cell? S for stellate cell and B for the basket cell. And what about the inner layer? Inner layer is granular, and it is GG cell. What is this GG cell? One is the granule cell and the other is Golgi cell itself. So as you're talking about the cells in cerebellar cortex, there are 5 cells in the 3 layers. When you say there are 5 cells in the 3 layer, what is the middle layer? Middle layer is the Purkinje cell, but the outer layer is stellate basket, and it is the molecular layer. And if you say granular layer, there is the GG cell, Golgi and granule cell. This is what we want to discuss, and this is the cerebellar folia. When you say this is the cerebellar folia, leaf-like appearance, there will be the white matter here. This is the white matter. Now, when you say the white matter is coming, it will actually enter the leaf-like structures, and those leaf-like structures are called folia. Let us magnify the area. This white matter was the arbor vitae. We have discussed arbor vitae, the white matter within the gray matter. So what do you want to know? What I want to know is that there is an outer molecular layer, and there's a middle Purkinje cell layer, and then there is this inner granular layer. You have magnified the folia, yes, and this is the arbor vitae. This is the arbor vitae. So that is the gray white matter within the gray matter. Yes, arbor vitae. Okay, can we still magnify this diagram? Yes, you can. But this is the cerebellar cortex, where you have the 3 layers and 5 cells, and as you magnify, you see there is an outer molecular layer, there is a middle Purkinje layer, and there is an inner granular layer, and this is the outer molecular layer, this is the Purkinje layer, and that will be the granular layer. So we'll still magnify, and when you still magnify, you'll find here this is the molecular layer. There you will have the stellate and basket cell, and this is the Purkinje layer. Now you should be able to identify Purkinje cell like flask-shaped cells with the multiple dendritic processes. So flask-shaped cell with multiple dendritic processes, yes, towards the molecular layer. So telling that the Purkinje cell is in the middle layer and they have multiple dendritic process towards the outer molecular layer. Yes, towards the outer molecular layer. That is how you identify Purkinje cells. With all that information, we are looking at some afferent fibers into cerebellum. Actually, cerebellar circuitry. And when you talk about cerebellar circuitry, there are questions coming. Cerebellum is a big topic and a lot of questions come at various levels. So we want to discuss almost everything out of it, and there are some climbing fibers. They are climbing to reach the Purkinje cell. Now, if they are climbing to reach the Purkinje cell, they are excited to Purkinje cell, but to reach the Purkinje, they will use the inferior cerebellar peduncle. There they will be crossing the midline also, and they come from the inferior olivary nucleus. That is why they are also called olivocerebellar tract. Means there are some climbing fibers which will come from the inferior olive nucleus in the medulla oblongata. In the medulla oblongata, you have the inferior olivary nucleus, and that is sending some fibers to cerebellum. That is why it is called olivocerebellar tract, and is passing through the inferior cerebellar peduncle, crossing also to reach the Purkinje and excite the Purkinje. There are other set of fibers also. They are called mossy fibers, and we have to understand that there are two types of incoming fibers, mossy and climbing. Though mossy are predominant. So predominantly the mossy fibers and very few climbing fibers. So climbing fibers are very few, and mostly they are mossy fibers. What about the mossy fibers then? Let us look at the details, but this is the diagram we have to draw. But before you draw the diagram, you have to discuss what you are supposed to draw. First of all, you can tell this is inferior olive nucleus in the medulla oblongata. If that was the inferior olive nucleus in the medulla oblongata, it was sending some climbing fibers. And where are the climbing fibers going? Those climbing fibers were actually going towards the Purkinje cell and exciting the Purkinje cell. So inferior olive nucleus in the medulla oblongata will give climbing fibers which will be stimulating the Purkinje cell. Is that so? What about the mossy fibers? Because these are very few. These are very few. And you told it is using some inferior cerebellar peduncle. Yes, inferior cerebellar peduncle they use. Now, there are actually 3 layers and 5 cells. We have to discuss now the 5 cells in the cerebellar cortex. When you're talking about the 5 cells in the cerebellar cortex and their circuitry, you will understand that stellate and basket are there in the outer molecular layer. And if you are talking about the Purkinje cell, then it is in the middle layer. Purkinje cell are in the middle layer. And if you are talking about the GG cell, that is granule and Golgi cell, GG cell, then they are actually in the inner granular layer. They are called granular layer because granule cells are there, inner GG cell. Now, you see, Purkinje cells are in the middle layer, and they are the chief efferent of the cerebellar cortex, because there are 5 cells. Only Purkinje cell is the only efferent of the cerebellar cortex. This question comes in the cerebellar cortex. There are 5 cells, but only 1 cell can send the information away, and that is called the Purkinje cell. Just some questions there. Now, this was the inferior olive nucleus, and it was sending the climbing fibers to stimulate the Purkinje cell. But climbing fibers are very few in number. Mostly we got the mossy fibers. We talk about mossy fiber now. See, mossy fibers come from many sources. I'll discuss 3 of them: vestibular, spinal, and CPC fiber. Vestibulocerebellar for balancing, spinocerebellar for that coordination thing, and CPC fiber, corticopontocerebellar fibers. They're all passing through, see, vestibulocerebellar inferior, spinocerebellar inferior, but there is also few fibers passing superior. If you remember, we have discussed 2 of the cerebellar tracts. Dorsal is in the inferior, ventral was in the superior, and then we have the middle cerebellar peduncle where we have decussation of the, see, this is pontocerebellar tract. If you remember, we have discussed pontocerebellar tract are in the middle cerebellar peduncle. Beginning of the discussion we have told pontocerebellar because middle cerebellar peduncle is connecting pons with cerebellum, so pontocerebellar tract. Anyway, remember, mossy fibers are excitatory on the granule cell using some glutamate. So they are excitatory to the Purkinje again. Yes, climbing fibers are also excitatory. Yes, they were. also excitatory. Now with that information, I am telling one person to walk in a straight line, and as he is moving his right lower limb, the right-sided dorsal spinocerebellar tract is activated. As the right-sided dorsal spinocerebellar tract is activated, let us discuss the circuitry now. Right lower limb has moved and right-sided dorsal spinocerebellar tract is activated. As the right-sided dorsal spinocerebellar tract is activated, it will give you the mossy fibers, and those mossy fibers are going to synapse in the granule cell and excite the granule cell. Now, as the granule cells are excited, they themselves will have some parallel fibers, and using the parallel fibers, they are going to excite the remaining four cells. So you mean to say, if once the granule cells were excited by the mossy fibers, then the granule cell themselves have some parallel fibers to excite the other four cells. What are the other four cells? They are the stellate basket in the outer layer, Purkinje in the middle layer, and granule in the inner layer. Name. See, stellate and basket are excited in the outer layer, and the Golgi cell will be excited in the inner layer, and Purkinje cell will be excited in the middle layer. So what will happen now? What will happen now means all the 5 cells will have the process information of the right lower limb moved. So because the right lower limb has moved, there is some process information in the 5 cells of the cerebellar cortex now. Yes, and out of 5 cells, only 1 cell has the capacity to send the information further, which is only the Purkinje cell. Now, where is this Purkinje cell sending the information out towards? Is a question. You'd say it is going towards the deep cerebellar nuclei like dentate nucleus. So it is going towards the deep cerebellar nuclei like dentate nucleus, and there it is using GABA, neuroinhibitory transmitter. So Purkinje uses GABA neuroinhibitory transmitter on the deep cerebellar nuclei here. Yes. Could be dentate nucleus. Yes, but it is GABA, so neuroinhibitory. And what is the deep cerebellar nuclei doing? They will then send the dentatothalamic tract towards the thalamus. Dentatothalamic tract towards the thalamus. So this is one pathway which we are supposed to draw, and let us do that. As you're drawing this pathway, you can tell that there are 3 layers in the cerebellar cortex and 5 cells again. This is the middle layer, which is the Purkinje. If you say this is the middle layer, which is Purkinje cell, then what is the outer layer? Outer layer, we have the stellate and basket cell, and inner layer we have the GG cell, and this G cell is the granule cell. That G cell is the Golgi cell. This stellate cell is outer layer, and basket cell is the outer layer. Now, once you have told about the cells in the cerebellar cortex, you are telling we have moved the right lower limb, and as the right lower limb is moving, the dorsal spinocerebellar tract was activated. And as this tract is activated, it will activate the granule cell. These are called as the mossy fibers. And these mossy fibers which came were exciting the granule cell. Now, granule cell itself is having some parallel fibers, and using those parallel fibers, it will be exciting the remaining 4 cells. So you are moving right lower limb, and dorsal spinocerebellar tract was activated, and it is making the mossy fibers which will be synapsing in the granule cell, so that granule cell itself is excited, sending some parallel fibers, and these parallel fibers are supposed to excite the other 4 cells, which are the stellate and basket and the Purkinje and the Golgi. Now, all of these cells were really activated by the parallel fibers, but all these cells, 5 cells, only 1 cell has the capacity to send the information further, and that is the Purkinje cell. Now, as the Purkinje cell is sending information further, the only efferent from the cerebellar cortex is Purkinje cell. Using GABA, the neuroinhibitory transmitter will activate the inhibit the dentate nucleus. And what is dentate nucleus? It is a deep cerebellar nucleus. And what is it doing? It is further sending information towards the thalamus. That is why it is called as the dentatothalamic tract. Dentatothalamic tract. So you're telling that there was this Purkinje cell sending GABA on the dentate nucleus, which is the deep cerebellar nucleus, which is sending dentatothalamic tract towards the thalamus. Is that so? Yes. And what about the inferior olive nucleus in the medulla oblongata? Inferior olive nucleus, which is in the medulla oblongata, was sending climbing fiber to stimulate the Purkinje cell. And these climbing fibers are stimulating the Purkinje cell are very few in number. If they are very few in number, which fibers are more in number? They are the mossy fibers. Mossy fibers are more in number and climbing fibers are less in number. These fibers are also called as olivocerebellar tract. They are also called olivocerebellar tract. So this is the circuitry which we wanted to know. You know, almost everything is excitatory here, except this Purkinje, which was inhibiting the GABA, which is neuroinhibitory. This is the inhibitory pathway. Otherwise, most of the pathways here are excitatory, though not necessarily everybody. But whatever we had discussed were excitatory, except this one. It was neuroinhibitory on dentate nucleus, the deep cerebellar nucleus. So this is something which we wanted to know. Now we want to talk about this question again. You already have known the marked cell is, yes, who is that? The marked cell is, yes, the Purkinje. How do you know it is Purkinje? Can you see one thing? Purkinje, flask-shaped cell, sending the dendritic process towards the molecular layer. So sending dendritic process towards the molecular layer. Yes. Okay. So you are talking about Purkinje cell here, and this is the molecular layer. Then that must be the granular layer. Yes. And this must be the arbor vitae. Yes, that is arbor vitae, axons. So these are the axons, arbor vitae, and this is the inner granular layer, this is the Purkinje layer, and this is the outer molecular layer, because the dendritic process are towards the molecular layer. Yes, that is why, molecular layer. So marked cell, Purkinje, is inhibiting what? GABA. What GABA? It is GABA to be used on deep cerebellar nuclei. For example, dentate nucleus. That is your answer. Now, once you got your answer, fine. Let's move further. You are telling that the answer is deep cerebellar nuclei, which could be dentate nucleus. Fine. Now we want to look at this. Efferents in superior cerebellar peduncle are mostly from, what do you think? Superior cerebellar peduncle, are you talking about dentatothalamic tract? Yeah, dentatothalamic tract. If you said dentatothalamic tract, then I'll tell you. It came from dentate nucleus. And what is dentate nucleus? That is the deep cerebellar nucleus. So that is the answer. Yes. Efferent and superior cerebellar peduncle are mostly dentatothalamic tract. And they came from dentate nucleus, which is a deep cerebellar nucleus. So that is the answer. Yes. Okay. We'll keep the answer then. If that is the answer, fine, but I need more details of dentatothalamic tract, these peduncles, the pathways. And if you want to discuss all that, then what you need is one more question. This question is asking efferent from cerebellum. Now, if you say efferent from cerebellum, no problem. We have just discussed dentatothalamic tract. That was the efferent. So dentatothalamic tract was efferent. Yes. Where it came from? No problem. It is the deep nuclei, the dentate nuclei. So again the answer is deep nuclei. Yes. Dentatothalamic tract is the major efferent from the cerebellum. But if somebody asks you Purkinje cell, then when will you answer Purkinje? Purkinje can be my answer only if somebody asks me efferent from cerebellar cortex. Cerebellar cortex. If somebody asks me efferent from cerebellar cortex, then I will say Purkinje cell. So see the difference. A question can ask you efferent from cerebellar cortex. That time your answer will be Purkinje, because it is the only cell which is giving efferent. But this question was just asking cerebellum. So somebody asking cerebellar cortex, you may answer Purkinje. But this question was asking cerebellum, so answer should remain dentate nucleus or deep nuclei. See, a single word can change the answer. Be careful. Here the answer is deep nuclei, dentate nucleus. Now, cerebellar pathways and the peduncles we have to discuss. As we're discussing cerebellar pathways and the peduncles, let's do that. We have to talk about dorsal spinocerebellar tract and dentatothalamic tract, and then there is the communication with the left cerebellum, cerebrum. This is the pathway which we are supposed to draw. And as you are drawing this pathway, this is the kind of diagram we are going to have. In this pathway, we will tell that this is the dorsal spinocerebellar tract, this is the dentatothalamic tract, and there is a left cerebrum activated. But what we want to know is about the peduncles basically. So let's do that. This is the midline of the body and the highest brain is cerebrum. So we are looking at the left cerebrum. Why? Because we are moving the right lower limb. So you want to look at the left cerebrum because you're moving the right lower limb. Yes. Okay. What is below that? Below that is thalamus on each side, but I am focusing upon the left thalamus. Left thalamus. Then what is below that? Below that is the brainstem. This is the brainstem. And what are the three components of brainstem? Three components of brainstem are, of course, midbrain, followed by pons, followed by medulla oblongata. So you have put a midline of the body there. Yes. And this is the highest brain, the cerebrum. Yes, this is left cerebrum, this is left thalamus. And below that is brainstem having midbrain, pons and medulla oblongata. Yes, what is below that? Below what? Below brainstem. Below brainstem is the spinal cord. This is spinal cord. Now, if you say this is the spinal cord, fine. I found some axons in the spinal cord. Which axons did you find? I found some axons in the spinal cord here. I want to discuss these axons in the spinal cord. But before you start discussing these axons in the spinal cord, you have to discuss cerebellum. Where is cerebellum? Cerebellum is attaching to the brainstem. If you tell the cerebellum is attaching to brainstem, how the cerebellum is attaching to brainstem? With the help of superior cerebellar peduncle and the middle cerebellar peduncle and the inferior cerebellar peduncle. So there is superior cerebellar peduncle, middle cerebellar peduncle, inferior cerebellar peduncle. Then what are these? Basically, they are cerebellar hemispheres. Cerebellar hemispheres. So right and left, yeah, this is left cerebellar hemisphere, that will be right cerebellar hemisphere. So basically you are talking about right cerebellar hemisphere, left cerebellar hemisphere attaching to the brainstem with the help of superior, middle, inferior peduncle. Now, carrying some fibers, yeah, I want to know which fibers which tract is carrying. This is the discussion. Now, as we were talking about the axons in the spinal cord, these axons are supposed to go to cerebellum, so we are calling them as spinocerebellar tract. And the spinocerebellar tract run in two bundles. You will find that the most of the fibers are dorsal and very few fibers are ventral. Dorsal is mostly and ventral are few. Yes. So dorsal are more and ventral are few. Yes. The names are dorsal ventral, spinocerebellar tract. So you are mentioning that there are some axons in the spinal cord which are going to cerebellum. That's why you are calling them as spinocerebellar tract, and most of those axons are running dorsal, very few ventral. Yes, clinically, dorsal is more important, ventral is less important. Okay, then we'll focus mostly on dorsal spinocerebellar tract then. Yes, that's the point. And as you say so, we have asked the patient to move the right lower limb. As the right lower limb was moving, there's a change of the position since the proprioception, and that proprioception was carried by right-sided dorsal spinocerebellar tract towards the cerebellum. There was this patient moving right lower limb, and the change of position since the proprioception was carried by right-sided dorsal spinocerebellar tract to the same-sided cerebellum. So this is the right-sided dorsal spinocerebellar tract. Yes, it is running ipsilaterally. Running ipsilaterally, forming mossy fibers. Forming mossy fibers and entering the same-sided cerebellum. Using inferior cerebellar peduncle. Inferior cerebellar peduncle. So once again, see, We asked the patient to walk in a straight line. As the right lower limb moved, the information was carried by right-sided dorsal spinocerebellar tract, and this information is running ipsilaterally, making the mossy fibers using the inferior cerebellar peduncle to enter the same-sided cerebellum. But then few fibers cross the midline. And as the few fibers cross the midline, you will find the few of the fibers are crossing the midline, you'll find they will start running as, see, the proprioception information, few fibers will cross the midline and start running as ventral spinocerebellar tract. Ventral spinocerebellar tract. So where is the crossing happening? In the spinal cord. In the spinal cord. You mean to say right lower limb moved, but the information is going to left side of spinal cord now? Yes. As ventral spinocerebellar tract, crossing in the spinal cord in the midline, and this fiber is using superior cerebellar peduncle to reach the left cerebellar hemisphere. So you're telling that ventral spinocerebellar tract is using the superior cerebellar peduncle, yes, superior cerebellar peduncle to reach the opposite side cerebellum, and this opposite side cerebellum is telling, where are you coming, where are you coming? I'm not your cerebellum, go back to your own cerebellum, and it'll go back to its own cerebellum, but that going back is within the cerebellum. It is not going to use any peduncle. It is called recrossing of fiber. There is a crossing of fiber in the spinal cord, and there is recrossing of fiber in the cerebellum itself. It does not use any peduncle. So you are mentioning that a few fibers of the right lower limb position crossing the midline are recrossing within the cerebellum. Yes, ultimately they should reach the same sided cerebellum, because right lower limb moved, right cerebellum should have the information. Okay, fine. Can we proceed further with mossy fiber? Yeah, you know, mossy fibers are going to stimulate the granule cell. And when they stimulate the granule cell, what the granule cell will do? Granule cell will stimulate many cells, and one of them is the Purkinje cell. So how will the granule cell stimulate the Purkinje cell? That is the parallel fibers. Parallel fibers. So you're telling that mossy fibers are going to stimulate the granule cell? Yes. And when the mossy fibers are stimulating the granule cell, their granule cell will stimulate the Purkinje cell. Yes, using the parallel fibers. And what the Purkinje cell will do? Purkinje cell is the only efferent from the cerebellar cortex. Yeah, okay, fine. But what is it doing? Purkinje cell is now using GABA on this dentate nucleus. This is the dentate nucleus in the cerebellum. So you're telling that Purkinje cell is using GABA on the dentate nucleus now? Yes. See, what we are telling is mossy fibers, dorsal spinocerebellar tract, is stimulating the granule cell, which is using parallel fibers to stimulate the Purkinje cell, and Purkinje cell is inhibiting the dentate nucleus using GABA. And what is the dentate nucleus doing? Dentate nucleus is using superior cerebellar peduncle to reach the opposite sided thalamus, dentatothalamic tract, if you remember. So you're telling that dentate nucleus now is using superior cerebellar peduncle. Yes, superior cerebellar peduncle. So dentate nucleus is using superior cerebellar peduncle so that it will come and go to the thalamus on the opposite side. Yes, actually, as it is going to the opposite thalamus, it is passing through the red nucleus in the upper midbrain, and passing through the red nucleus in the upper midbrain, this pathway has a name which is called as dentatothalamic tract, full name. You mean to say dentate nucleus, which is using superior cerebellar peduncle and communicating with the opposite thalamus, contralateral thalamus, is passing through some red nucleus in the upper midbrain. Yes, and because it is passing through red nucleus in the upper midbrain, that pathway is called dentatothalamic tract. Yes, dentatothalamic tract. Okay. Using superior cerebellar peduncle, fine. What is this thalamus doing? It is communicating left cerebrum. And what is the left cerebrum doing? Left cerebrum has the process information now for the movement of the right lower limb. So as the right lower limb has moved, the information proprioception was processed by cerebellum and sent to the left cerebrum, because it is the left cerebrum which is supposed to move the right lower limb. And how the left cerebrum move the right lower limb? Using the pyramidal tract, corticospinal tract. So you are telling that the left cerebrum must have the processed information of the movement of the right lower limb? Yes. And then only it can control it properly by corticospinal tract to the pyramidal tract? Yes, which crosses in the lower medulla. Crosses in the lower medulla. Corticospinal tract will cross in the lower medulla and then control this lower limb. And for coordination of voluntary motor activity. Coordination of voluntary motor activity. What if I have a lateral medullary syndrome? What is that? Lateral medullary syndrome. You mean to say Wallenberg syndrome? Yes. You mean to say ischemia, lateral medulla? Yes. If you have lateral medullary syndrome, Wallenberg syndrome, then the spinocerebellar tract is damaged and there will be cerebellar ataxia. What is cerebellar ataxia? Heel shin test will become positive and patient cannot walk in a straight line. So understand, when there is a lateral medullary ischemia, Wallenberg syndrome, spinocerebellar tract is gone. So the patient don't know the position sense of the lower limb. So heel shin test will become positive and cannot walk in a straight line in coordination. Cerebellar ataxia is in coordination. Okay. What about that CPC fiber? You were talking about some CPC fiber. Yes, it is a feedback mechanism and this is the CPC fiber. There is a feedback mechanism. It is CPC fiber. What is CPC fiber? Cerebropontocerebellar tract. So this is pons. Yeah, this is pons, of course. Okay, so you're telling this is the CPC fiber. Yes. That is cerebropontocerebellar tract. Yes. I think it is using middle peduncle. Yes, because pontocerebellar tract. You see, pontocerebellar tract. Okay, pontocerebellar tract, middle cerebellar peduncle. Fine. This is the CPC fiber. Yes. So you have to understand that the left cerebellum is sending fibers to the pons, which is crossing the midline, and using the middle cerebellar peduncle. These are also mossy fibers. They are also mossy fibers. So they will excite the granule cell. Yes. It's a feedback mechanism. Then the granule cell will excite the Purkinje cell, will inhibit the dentate, will be now going to cerebrum and again loop mechanism. Yes, it is a feedback mechanism actually. So, cerebrum is talking about cerebellum, yes, and cerebellum is talking about cerebrum, yes, they keep talking with each other, feedback mechanism. Cerebropontocerebellar tract using middle cerebellar peduncle. Now, one more thing we have to remember, if you remember, we have discussed there is a inferior olive nucleus in the medulla, and that inferior olive nucleus in the medulla is sending the climbing fiber to the Purkinje cell, if you remember. So you're telling that inferior olive nucleus in the medulla is sending some climbing fiber to the Purkinje cell? Yes. And they are called olivocerebellar tract. These are the climbing fibers. And they are also called as the olivocerebellar tract. So you're telling that in the medulla oblongata there is an inferior olive nucleus, and which is sending some climbing fiber towards the Purkinje cell using which peduncle? The inferior cerebellar peduncle. So in the inferior cerebellar peduncle you have one set of mossy fiber and one set of the climbing fiber. Who is the mossy fiber? Mossy fibers, you already know, is dorsal spinocerebellar tract. That is the mossy fiber. Then who is the climbing fiber? Climbing fiber is, of course, olivocerebellar tract. So this is the olivocerebellar tract, which is climbing fiber, which is passing inferior cerebellar peduncle there. Yes. Can you tell me one incoming fiber in each peduncle? Now, one incoming fiber in each peduncle, I'll tell you two. See, this is olivocerebellar tract in the inferior peduncle, and this is the dorsal spinocerebellar tract in the inferior peduncle. Can you tell me one incoming fiber in the middle peduncle? Yes, that was the pontocerebellar tract. Full name is corticopontocerebellar tract. And can you tell me one incoming fiber in the superior peduncle? Yeah, this one. Who is this incoming fiber in the superior peduncle? That was very few fibers, and name ventral spinocerebellar tract. So ventral spinocerebellar tract is the incoming fiber in the superior cerebellar peduncle. Can you tell me one outgoing fiber in the superior cerebellar peduncle? One outgoing fiber in the superior cerebellar peduncle is the dentatothalamic tract. Full name? Full name is actually dentatorubro-thalamic tract. So this is the dentatorubro-thalamic tract, and it is the outgoing channel in the superior cerebellar peduncle. Yes, these are some of the questions which you have to remember, and let us practice the MCQs now about the cerebellar peduncles. See, climbing fibers are olivocerebellar, inferior cerebellar peduncle, excitatory to Purkinje, crossing in the medulla, climbing up the inferior peduncle. This is what we said. Mossy fibers came from spinocerebellar tract. If it is inferior cerebellar peduncle, it was dorsal. If it was superior cerebellar peduncle, it was ventral. So mossy fibers are from various sources, but spinocerebellar tract we have discussed. There is a dorsal, which is inferior cerebellar peduncle. There's ventral, which is superior cerebellar peduncle. Though superior is not very important, and it was excitatory to granule cell, of course, which themselves are excitatory to Purkinje using some parallel fibers. And then you have CPC fiber. Where is CPC fiber coming from? Cerebral cortex to the pons to the cerebellum. Which peduncle? Middle peduncle. Decussation in the pons only. So CPC fiber, corticopontocerebellar tract, is a feedback mechanism, and it is passing through middle cerebellar peduncle there. And additionally, you can just remember some vestibulocerebellar tract, which is also using inferior cerebellar peduncle. It is, we learned it from the fish. We remember axial balance, fish axial balance. Okay, with that information, you are looking at this question asking, tract not present in inferior peduncle. Not. Immediately you know the answer. But why? That is the answer. Because dentatorubro-thalamic tract is not in the inferior peduncle. Then where it is? Superior cerebellar peduncle. Then what about the dorsal spinocerebellar? Of course, dorsal spinocerebellar is in the inferior cerebellar peduncle, forming mossy fiber. And what about olivocerebellar? Olivocerebellar is inferior peduncle, climbing fibers. Climbing fibers. And what about the cuniocerebellar? Actually, cuniocerebellar is the upper limb proprioception. And if you say it is the upper limb proprioception, it also uses inferior cerebellar peduncle. See, lower limb proprioception is dorsal spinocerebellar tract, and upper limb proprioception is cuniocerebellar tract. But both use the inferior cerebellar peduncle. If you want to know the position sense of upper limb, you use cuniocerebellar tract, but that is also using inferior cerebellar peduncle. So is it okay here? Yes, that is okay. Problem is with, see, cuniocerebellar upper limb proprioception using inferior peduncle, no problem. Problem is with that. So cuniocerebellar carry proprioception of the upper body, run via cuneate fasciculus, accessory Neuroanatomy is never-ending quest. So cuniocerebellar tract carrying some proprioception of upper body to the cuneate fasciculus. What is all this? What is happening? Sometimes even I wonder what is happening. Anyway, don't bother here. Just tell me the answer. Answer is dentatorubro-thalamic tract. And then there is this question, PGI Chandigarh question, triple repeat, asking what is not present in the inferior peduncle. And by this time you will know mostly what is the answer. Multiple answers can be there, PGI Chandigarh. So what do you think the answer is? See, in this question, these are my answers immediately. Why? Because pontocerebellar tract is present in the middle cerebellar peduncle, not the inferior, and the anterior spinocerebellar tract, which is ventral spinocerebellar tract, is present in the Superior cerebellar peduncle, not the inferior. This question is on inferior peduncle. So these are the answers. Yes. What about the cuneocerebellar? We just said upper limb proprioception, inferior peduncle. What about the dorsal spinocerebellar? Dorsal spinocerebellar, you don't know. It is inferior peduncle. What about the vestibulocerebellar? The fish thing, axial balance, inferior cerebellar peduncle. So somehow we have managed the information, which is too much, enormous for the human brain. There's a chance that we'll have short circuit now, though the cerebellum is over. But by this time, you must be having some short circuit in the brain. Too much of information. But it is important. We have to deal with the questions. So we'll keep these answers. Yes, they are the exceptions. They are the answers. Pontocerebellar is in the middle cerebellar peduncle, not inferior. Anterior spinocerebellar tract is superior cerebellar peduncle, not inferior.